but I do have some leftover acne scars from that cystic acne, and I'm always looking for ways to treat it, to minimize it. So how do you treat it, and what are acne scars? Let's start off with that.
Well, the acne scar is an area where the acne has gone down into the dermis and causing more of a damage or in the collagen that was not able to repair itself, so it's causing an indentation. We would like to try to treat the acne before it gets to that point. So by giving oral antibiotics, topical treatments, lasers, IPLs, things like that to help prevent the depth of the cystic acne. If it happens that you had a cystic acne and you didn't pick it, it just happens that the acne healed that way. Then we have lasers to help build collagen, which is like a vascular laser. We have Fraxel, which will iron out the scar, actually, stimulate collagen. We can fill with fillers with like hyaluronic acids. And also there's threads that we can pull and stretch. As time goes on, your skin gets more lax, and we could pull it back. And then there's also mild peels, like glycolic peels or salicylic acid peels, microneedling now with your PRP, which is your stem cells with growth factor, to put on top of the skin to help mainly build collagen to uplift that dermis so your scar isn't so indented.
So it creates sort of the injury, correct? Is that how it works with the microneedling and the PRPs? They create sort of injury so your body produces that collagen?
Right, it's all about little micro controlled injuries so that you get a better collagen base and it improves the scar.